Many seniors believe that more medical checkups equal better health, but after the age of 70 this is not always true. There are certain tests that may seem safe or even necessary, yet research shows that they can cause more harm than good. Millions of older adults undergo these procedures each year without being told about the risks. The result is often unnecessary treatment, complications, and a decline in quality of life. Medicine can save lives, but sometimes less is actually more. One of the most common examples is the bone density scan, also known as a DEXA scan. It is a quick and painless test that measures how strong your bones are and whether you might be at risk for osteoporosis. For seniors it sounds harmless, but the truth is different. After 70, nearly every scan shows lower density because bone loss is a natural part of aging. Just as wrinkles appear on the skin and hair turns gray, bones also change with time. The test often leads doctors to prescribe medications that are not always needed. The most common medications are called bisphosphonates. They are intended to prevent fractures, but they come with very serious side effects. These include irritation of the esophagus, digestive problems, brittle bones that may break in unusual ways, and in rare but devastating cases, jaw necrosis, which is when the jawbone begins to die. Studies reveal that these drugs have only a very small impact on fracture prevention in seniors, far less than what most patients expect. When weighed against the possible risks, the balance is often negative. A real case demonstrates this danger clearly. A 76-year-old woman, who was a retired piano teacher, was told to take a bisphosphonate after a bone scan showed mild reduction in bone density. She had never suffered a fall and had no pain. Within 3 months of taking the drug she developed severe reflux and pain in her jaw. She could not play piano and her daily life was disrupted. After stopping the medication and instead focusing on vitamin D, calcium-rich food, and weight-bearing exercise, she regained her health and strength without further problems. This shows that lifestyle can be a far more powerful tool for seniors than prescription drugs. Regular strength training, balance exercises, walking, and proper nutrition reduce the chance of fractures more effectively and with fewer risks. A major study published in 2022 showed that these lifestyle measures can lower fracture risk by more than 20%, which is far more effective than medication in this age group. For those over 70 who are not falling or breaking bones, the scan and the pills may do more harm than good. Another test that should be questioned is the brain MRI for memory loss. It is normal to feel worried when you misplace keys or forget a name. Fear of dementia or Alzheimer's disease is very common. Doctors often order an MRI of the brain to look for changes. The problem is that MRIs rarely provide useful answers for mild memory issues. Most results show age-related changes like slight shrinkage or small white matter spots. These findings are normal, but once they are discovered they can cause unnecessary fear. In fact, a large study showed that 86% of seniors who received MRIs had some kind of abnormal result, yet only 3% of these results were actually linked to a treatable condition. The rest were simply natural changes of aging. Unfortunately, vague scan results often lead to more tests, spinal taps, or even surgery. Almost 12% of seniors in the study were sent for invasive procedures that did not help them. What was left was fear, stress, and risk, not clarity. Instead of rushing to imaging, seniors should begin with simple cognitive screening tests. These are paper-based exams that check memory, problem-solving, and attention. They are safe, cheap, and effective. They can give a clear picture of whether forgetfulness is a normal part of aging or a more serious issue. Along with this, lifestyle habits such as good sleep, proper hydration, mental exercises, and social engagement can stabilize memory. Many seniors who thought they were declining found their memory improved after focusing on these simple steps. Another common checkup that becomes risky after 70 is the cardiac stress test. This test is usually done when a person complains of fatigue, chest tightness, or just not feeling as strong as before. It involves walking on a treadmill or receiving medication that simulates exercise while the heart is monitored. The idea is to detect blocked arteries before they cause a heart attack. However, in older adults this test often leads to more harm than good, especially when the individual does not have clear heart disease symptoms. The main issue is the accuracy of the test. In seniors the false positive rate is very high, sometimes reaching 40%. That means nearly half the time the test may indicate a serious heart problem when none exists. A false positive does not end with the stress test. It usually leads to further testing, such as angiograms, catheterizations, and even the placement of stents or bypass surgeries. These procedures carry serious risks like bleeding, kidney injury from the contrast dye, and long hospital stays. What is worse is that for patients who did not truly have dangerous blockages, these procedures do not improve survival or quality of life at all. There was the case of a 75-year-old retired postman who stayed active by walking every day. He mentioned to his doctor that he sometimes felt tired while walking uphill. Even though he had no chest pain or shortness of breath, the doctor ordered a stress test. The results were unclear, and so he was sent for catheterization. A mild narrowing was found and a stent was placed. That night he developed kidney problems from the contrast dye and spent almost a week in the hospital. His fatigue did not improve, because it was never a heart problem in the first place. It was a matter of hydration and rest, not blocked arteries. For older adults who do not experience chest pain with activity or shortness of breath during exertion, safer alternatives exist. A resting EKG, which looks at the heart rhythm while sitting still, can provide useful information without the risks of a stress test. Another option is a coronary calcium scan, which involves low radiation imaging to check for plaque buildup. These tests are simpler, safer, and less likely to result in dangerous and unnecessary procedures. The colonoscopy is another test that needs to be reconsidered after 70. Many people are surprised to hear this, because colonoscopy is widely promoted as a life-saving procedure for catching colon cancer early. It certainly has benefits in middle age, but as people get older the risks begin to outweigh the rewards. The preparation for colonoscopy involves strong laxatives, which can cause dehydration, dizziness, and kidney issues in older adults. Sedation adds further risk, sometimes affecting brain function and recovery. The procedure itself is not risk-free either. Bleeding, tearing of the bowel, and irregular heart rhythms from sedation are all possible complications. A large study of over 1 million Medicare patients aged 70 and older found that for every 1,000 colonoscopies, only 2 lives were saved. At the same time, more than 20 people suffered serious complications. That is a risk-to-benefit ratio of 10 to 1. Furthermore, many of the polyps discovered in older adults are small and slow-growing. Removing them may cause more damage than simply leaving them alone. A clear example of this problem was seen in a 73-year-old grandmother who had no symptoms, no family history, and had already had 2 clean colonoscopies in the past. Her new doctor urged her to have another one. During the procedure a small polyp was removed, but that night she experienced severe abdominal pain. She had suffered a bowel perforation, which required more than a week in the hospital and left her weaker than before. In her case, the procedure offered no real benefit and caused lasting harm. For most people over 75, routine colonoscopy is not recommended anymore. Safer alternatives, like stool-based tests such as the FIT test, can detect concerning signs without the risks of sedation or invasive procedures. The most concerning checkup for seniors is the full-body CT scan. This test is often marketed by private clinics as part of an executive health package or as a way to detect cancer early. At first, the idea sounds appealing. The promise of scanning every part of the body to find hidden threats seems like the ultimate form of prevention. However, the reality is very different. For people over 70, full-body CT scans carry enormous risks, and there is no proof that they actually extend life or improve health outcomes. One of the greatest dangers is the amount of radiation exposure. A single full-body CT scan delivers 10 to 20 millisieverts of radiation, which is equal to about 500 chest X-rays. This is a very large dose, and repeated scans increase the cumulative risk of cancer. In fact, recent studies suggest that up to 5% of all cancer cases in the United States may now be linked to the rise in CT scan use. This makes routine scanning not just unnecessary but actively harmful for many people. Another issue is the problem of incidental findings. A scan may reveal tiny nodules, cysts, or calcifications that are harmless and simply part of the normal aging process. Once they are The biopsy collapsed part of his lung, leading to a hospital stay and a long recovery. In the end, the nodule was harmless, but the intervention caused real damage. His independence and physical strength were diminished because of a problem that did not exist. Professional guidelines are clear about this issue. The American College of Radiology and other expert groups strongly advise against the use of full-body CT scans in people without symptoms. They provide no proven benefit and carry significant risks. Targeted imaging is a different matter. If a person has symptoms such as unexplained weight loss, coughing up blood, or visible swelling, then a focused scan may be appropriate. But scanning the entire body without any clear reason is more likely to cause harm than good. The better path is to listen to the body and to focus on tests that are clearly indicated. Preventive health should not be based on fear or on the hope of catching every possible disease before it appears. Instead, it should focus on lifestyle factors that have been consistently proven to extend life and improve well-being. Staying active, maintaining a healthy diet, getting good sleep, and keeping up with regular but appropriate checkups all play a far greater role in longevity than high radiation scans. This truth can feel uncomfortable because modern medicine often emphasizes early detection at any cost. However, after 70 the equation changes. The risks of aggressive testing grow larger while the benefits become smaller. That is why thoughtful decision-making is essential. Seniors and their families should always ask an important question before any test: what happens next if the results show something? If the answer involves more tests, invasive procedures, or unclear outcomes, then it may be time to step back. When all of these examples are considered together, a clear picture begins to emerge. The belief that more testing always means better protection is deeply ingrained in our culture, but it is not always supported by evidence. After the age of 70, the human body naturally changes in ways that will show up on scans and lab reports. These changes are often harmless, yet once they are labeled as abnormal, they can push patients toward treatments and procedures that are unnecessary. This is why so many seniors end up in hospitals or on medications that do not actually improve their lives. The danger is not only physical but also emotional. A test result that suggests a problem, even when it is not dangerous, can trigger significant anxiety. Seniors may start to believe they are ill, even when they are healthy. This fear can alter daily habits, reduce confidence, and lead to a decline in mental well-being. In some cases, the worry created by an unnecessary test can be more damaging than the condition it was supposed to detect. The cycle of stress, testing, and intervention is hard to escape once it begins. It is important to remember that prevention is still valuable, but prevention does not always mean more tests. True prevention comes from supporting the body with the right lifestyle choices. Exercise, balance training, and resistance activities build strength and lower the chance of falls. Nutritious food, especially diets rich in vegetables, fruits, whole grains, lean proteins, and calcium, helps protect both bones and organs. Adequate vitamin D, either from sunlight or supplementation, is especially important for older adults. Sleep, stress management, and social connections also play powerful roles in protecting health. Seniors should be encouraged to build habits that increase resilience instead of chasing perfect numbers on a medical report. A healthy routine that includes walking, stretching, or even dancing can add vitality and confidence. Simple cognitive activities like puzzles, reading, or learning a new skill can sharpen the mind. None of these habits carry the risks that invasive testing does, yet they provide real, measurable benefits. They also strengthen the sense of control and independence that is vital for quality of life in later years. Doctors and patients both have a role in making wiser choices. Patients should feel empowered to ask their doctors hard questions before agreeing to any test. They should ask, what will this test tell me that I do not already know? What is the chance that the result will change my treatment in a meaningful way? What are the risks of the procedure itself? These questions shift the conversation from automatic screening to thoughtful care. The goal should always be to add years of good health, not to chase small percentages of risk reduction at great personal cost. Families also play an important part. Loved ones often push seniors into tests out of fear or concern. While the intentions are good, the outcome can be harmful. It is essential for families to understand that aging naturally involves changes that do not always require intervention. Supporting healthy daily habits, encouraging activity, and providing companionship can be far more protective than repeated hospital visits. Compassion and patience often do more for long-term health than any high-tech scan. The medical system itself is beginning to acknowledge these truths. Many professional organizations now recommend limiting certain screenings after a specific age. The United States Preventive Services Task Force, for example, advises against routine colonoscopies past 75. Similar guidance exists for other tests. These recommendations reflect a growing recognition that the balance between risk and reward shifts as we age. Seniors and their families should be aware of these guidelines and use them to guide decisions, rather than feeling pressured into tests that are unlikely to help. The final and most important message is that health after 70 is not about chasing every possible test, but about preserving quality of life. Seniors deserve to live with strength, dignity, and peace of mind. Endless procedures can take away that peace, leaving behind fear and complications instead of freedom. Choosing wisely does not mean ignoring health. It means focusing on what truly makes a difference. The goal should not be to spend more time in clinics and hospitals, but to spend more time enjoying life with family, friends, and meaningful activities. Modern medicine is powerful and can save lives when used correctly. It has the tools to treat infections, repair injuries, and manage chronic diseases effectively. But it is not perfect. Every tool has a limit and every intervention has a cost. For older adults, the cost of unnecessary testing can outweigh the benefit. Understanding this reality allows seniors and their families to use medicine in a way that supports life instead of interrupting it. It is a matter of balance, not of rejecting medical care entirely. The principle of less is more can feel counterintuitive, especially in a world that values early detection and constant monitoring. But science shows that restraint can sometimes be the best form of care. If a test is not likely to change treatment in a meaningful way, then it may not be worth the risk. This mindset shifts the focus away from fear-driven decisions and toward deliberate, informed choices. It allows seniors to say no when necessary, without guilt or hesitation, because saying no can actually protect health. Real prevention comes from consistent daily habits that build resilience. Movement keeps muscles strong and bones durable. Restorative sleep heals the body and clears the mind. Nutritious meals provide the fuel for every system to function properly. Hydration supports circulation, digestion, and cognition. Social interaction protects against loneliness and cognitive decline. These ordinary choices, repeated every day, are what truly extend life and improve its quality. They are the foundation upon which any medical care should be built. When considering any test, seniors should pause and ask one crucial question: what happens next if the result is abnormal? If the answer involves further invasive procedures with unclear benefits, then it may be best to reconsider. If the result will only add fear without offering a real solution, then the test may not be worthwhile. On the other hand, if a test can provide clear, actionable guidance that will genuinely improve health, then it has value. The key is to evaluate each situation individually instead of following a routine checklist. Communication with doctors is essential in this process. Seniors should feel comfortable discussing their goals for health and life. Some may want every possible measure taken, while others may prioritize comfort and independence. There is no one right answer for everyone, but there is always a right answer for each person. Open conversations ensure that care aligns with personal values rather than automatic protocols. Medicine should serve the patient, not the other way around. In the end, the best advice is simple. Stay active, eat nourishing foods, sleep deeply, connect with loved ones, and choose tests with wisdom rather than fear. Every year is valuable and should not be wasted on unnecessary worry or avoidable harm. By focusing on what truly matters, seniors can live with more confidence and joy. And when health decisions are made with care, the later years of life can be not only longer but also brighter and more fulfilling.